well, no, it's not. They've been in the hospital for 2 months, and I don't really know when the end is going to be. And so these traumatic events continue over and over again. And when you have a medically fragile child, they continue because you're still going to the doctor's offices, and you're still going to hospitals, and you're still doing other types of things. So it's important to understand that, you know, it's very difficult for us to heal from this initially. And you know, at any point, if anything that I'm saying is too difficult for people to hear, you know, please, you know, feel free to step out or take a break. You know, it's certainly not meant to be punitive at all. This is meant to be explorative and to sort of understand that, you know, we all are not alone, and that you know, that this is not anybody's fault. But what I'm going to do is also talk about what we can do about it. The other problem is that, you know, well, actually we've talked about this, the guilt and the shame, and also I think, which is really what happened to me, was it was very difficult to relive the experience. You know, if your friends really want to hear about it, it's kind of hard to talk about over and over and over again, because you're thinking, well, you know, when am I going to get over this? So what happens when you have all of this emotional distress and all of this depression and PTSD, and you're thinking, am I the only one? And obviously you're not, because 12.5% of babies are born prematurely every year, and I like to say it's the most common condition that no one ever talks about. And I always compare it to autism, which affects only 1 to 2% of children, yet that's in all the newspapers all the time. It's, you know, I don't know how many times Jenny McCarthy's been on Larry King, and I've yet to see Larry King do anything about prematurity. You know, this is on over and over to talk about things that we can actually do to make things better. And that's also a big focus in my book, is talking about how we can harness then this mind-body connection. The first step is to understand that it's there. The second step is to understand that it's not anybody's fault. And then the third step is to say, now what can I actually do about it? And there's actually a lot of really good self-care things that we can do. What I'm going to do is I'm going to read another section, another quote from the book, and then hopefully everything will be back on, and then we can go from there. So, I never really understood despair until my boys were born. It's true that life was better when they came home, but I was having difficulty getting my brain around why. I was angry, sad, and resentful. I threw myself into the medical needs because it was easier than opening the Pandora's box of my emotions. One night, as I lay on the couch, wrapped in a blanket of grief and self-pity, I was flipping channels on the TV and stopped for some unknown reason at The Tonight Show. Jay Leno was interviewing Nicole Kidman, and the conversation turned to her divorce from Tom Cruise. It was clearly very painful for her to discuss. She mentioned how she had problems accepting the loss. When asked how she had managed to cope, she repeated advice she received from her father. It is what it is. It's not what it was meant to be, but it is what it is. At that moment, she was not a Hollywood star, but a fragile woman who had been deeply hurt, sharing an intimate father-daughter moment. I was moved by her frailty and candor. Her father's advice was simple, brilliant, and insightful, because dealing with tragedy is about accepting a new reality. We're meant to move forward, not dwell in the past. It's only when you accept a situation that you can learn how to adapt, which is essential for both emotional and physical survival. That night, I repeated it out loud, "It is what it is." I drew strength from hearing the words. I repeated them over and over, each time feeling a little bit better. In the past 6 years, I've repeated them again and again, sometimes out loud and sometimes to myself. These 5 words have become my mantra, and they're truly words to live by. And it's really true for me. I say that to myself all the time. It is what it is. And it's really interesting when you start looking at people who are really into yoga and into sort of, you know, the types of practices that really focus on developing a personal mantra. I found that's actually been very, very helpful for me, because we all get in these situations where we're just overwhelmed and we don't know what to do. And the thing we need to do is actually figure out how to break the moment. And having your mantra, something that's really simple, really very short sentence, can actually really help you get grounded again and kind of start over. So it looks like we're going to be without some audiovisual equipment for a bit, but that's okay. We can ad-lib. That's sort of what life's all about. So for me, the first, what I talk about with in the book, and also what I practice at home, is really a very sort of simple steps of self-care. And I think that one of the things that we think when we have babies in the intensive care unit, when we have them at home, is that we have to be there every single second. But what my message is that taking care of yourself is taking care of your baby. Because we know that when we're stressed, when we have these problems, that has a negative effect on our babies. And it's better for us to be in better shape for 8 hours a day than to be in worse. What I do at home, and what I used to do when my kids were in the intensive care unit, is to just stop and take a couple of big, deep belly breaths. Your belly goes out and it goes back in. It's not the kind of breathing you do when you're wearing really tight clothes and you want someone to think you have a thin waistline, but it's the kind of breathing that brings in lots of good oxygen into your lungs. And so one of the first things that you can do is anytime you feel the tension rising just a little bit, is to stop, put your hand on your belly, and take a big deep breath. Whenever I have to meet somebody that I don't like, and I'll be honest, I sometimes have patients that are difficult to get along with. In pain medicine, we deal with a lot of addiction. A lot of people who don't think they're addicted because it's Vicodin and Percocet, not speed or heroin. But I have to walk in the room and talk to somebody who's maybe lost a prescription. Wink, wink, but there's no police report. And I take a big deep breath before I walk in. Before I take the boys to a new specialist, we take a big deep breath before we walk in the door. And I actually started my boys with yoga lessons when they were 3. And it's very difficult for them to kind of learn how to take a big deep breath. So what I do with them is I say, pretend my finger's a candle. And I want you to take a big deep breath and I want you to blow it out. So whenever they're worked up or they're worried, we work on blowing out a candle. Because all kids know how to blow out a birthday candle, right? They can get that. They might not understand the diaphragm, the big belly breathing, but they can understand that. And helping them actually break the moment can be really helpful. And so now when my kids get really worked up, I say, what are you supposed to do? I'm supposed to blow out the candle. Then that gives them something else to focus on. So that deep belly breathing is one of the first things to do. The second thing to think about is to go for a walk. And you say, oh, well, that's pretty simple. But, it actually also really works, because when you walk, you're taking those big, deep belly breaths, and you're really just getting a little physical break as well as an emotional break. You're having all those catecholamines running through your system, which is very, very helpful. And so when my kids were in the intensive care unit, I actually took 3 10-minute walks a day around the hospital. And I found it was really, really helpful for me to do that, just to get out and have that mental break and have that fresh air, knowing that then I'd come back and I wouldn't be so worked up. Because I'm sure you've all realized, everybody who has kids here, that if you're worked up, it's harder for you to get your kids calmed down than if you walk into the situation all nice and calm. Then you can kind of bring everybody down with you. Now, I'm hoping we can get this back up and running, but if not, we'll be able to put the links up on the Handheld website. I also have some links to some great free affirmations. Now you're thinking, well, what's an affirmation? Well, that's what I did when I was in the hospital, when I was pregnant and trying to get those extra 3.5 weeks. I told myself every single day, we're gonna get to 26 weeks. I'm stronger than this. And affirmations can be any type of positive thought related to an outcome that you want. And it's not so simple as, gosh, it's not like The Secret where you think it and it's going to happen. But it's one of those things that you're training your brain to kind of work in the way that you want to have the best chemical response. And so I actually have a list of great free downloads with affirmations that you could download to your iPod and listen to. There's also great guided imagery, and it's for every single thing that you could think about. Anger, stress, insomnia, even weight loss. I listen to that one a lot.